we have first Dr. Agnes Binagwaho. I believe she's here. She's the Vice Chancellor and co-founder of the University of Global Health Equity. Back in 1996, she provided clinical care in public sector and has served the Rwandan health sector in high-level government position, first as the Executive Secretary of Rwanda's National AIDS Control. Dr. Agnes has published over 220 peer-reviewed articles and was named among the 100 most influential African women for 2020 and 2021. Welcome, Dr. Agnes. And up next, we have Dr. Sheila Davis. She is the CEO of Partners in Health. Prior to this, Dr. Davis served as the Chief of Clinical Operations and Chief Nursing Officer at PIH, where she oversaw nursing efforts as well as supply chain, medical informatics laboratory, infrastructure, and quality improvement activities. Dr. Davis is a frequent national speaker on global health and clinical topics, including HIV or AIDS, the Ebola epidemic, leadership in public health, and the role of nursing in human rights. We have Dr. Davis. I believe she's going to be joining us live, online. And then up next we have Christopher Bailey. He is the Arts and Health Lead at the World Health Organization based in Geneva, Switzerland. His program focuses on the research agenda, community implementation, and mobilizing the global media to explore understanding and support the health benefits of the arts in everyday life, as well as an instrument in the field. Welcome, everyone, and thank you for blessing us with your presence, Dr. Agnes.
Thank you for your kind introduction. Honorable Minister, thank you for joining us. We are blessed because not only we have a very dynamic minister, but we have an artist. That's how I knew the first time Honorable Minister is writing great poem in Kinyarwanda. So I believe I'm not in the way of Sheila and Christopher.
I believe you're not.
Okay.
Welcome, Christopher and Dr. Davis. I hope you are doing well wherever you are. We can still see you. It's still the pandemic, so I think Zoom also still works. Now, without further ado, let's just start with today's topic. Right now, we're going to look at the role of arts in health and the contribution of Hamwe Festival. So the session will only last 30 minutes, and I would like to also invite each of you to contribute if a question to another panelist inspires you, or to add a reply, of course. So now, let's just start with a question, a general question for everyone. Starting with you, Dr. Agnes. After 3 editions of Hamwe Festival, could you talk to us about your experience at the festival and participation?
So my experience has been crescendo, meaning every year there is something new, and every year it is better. And even if the first one was so great, we had so much fun, we learned so much, we exchanged so much with young people coming from all African countries and beyond. The second one, we really exchanged with experts in global health from all over the world, from Australia, US, Europe, many parts of Africa, Latin America, and we discussed together, because this is the power of Hamwe Festival. It is to be in direct discussion with what happened globally. It's the University of Global Health, but Hamwe Festival is really a global discussion in the field of heart and health. And it has helped us, the expert in global health, to dig more in what heart can provide. And it started by bringing the realization of artists at the discussion with Hamwe. And you will see this year that we are at the third level. Hamwe is producing global health arts and bring it on the table for discussion. Also, it has shown us that global health and art, you can do so much with it for the patient. It helps people to heal quicker. It helps people to feel less pain. It helps people to feel less stress. And it has been proven that the hormone of stress, cortisol, is decreasing in the blood of people that face stress. So the people feel better. But it also improves the well-being in a society. And we can even see here in Rwanda, as more we develop, as more we exchange in communities, as more the heart take space in the life of our community. So I have learned a lot, and every year now I'm so curious about what the team is going to bring us, because every year it's better.
Most definitely. I couldn't agree more, because I've participated in most of them, and I've only seen amazing things. Now, Christopher, please tell us, how has your experience been at the Hamwe Festival and your participation as well? Um, can you increase the volume a bit?
Can you hear me?
Yes, we can definitely hear you now.
Okay, fantastic. Yes. So I had the pleasure of being at the inaugural Hamwe Festival a few years ago prior to the pandemic. And in many ways, it was a homecoming because back in the day, I worked with Partners in Health and other groups in Rwanda. I spent a lot of time in Binagwaho working on electronic medical record systems and in HIV groups. And one of the things I found is that often to get a sense of collaboration, ownership with new ideas, new solutions, uh, one could use theater and music to build that sense of joint ownership, of communication, of authenticity. And indeed, in WHO, one of our primary goals is to support the health of everybody, but in particular, underrepresented populations. But in the area of arts and health, it's a little different because in some ways that connection between arts and health has been lost in more developed societies. And that connection hasn't been lost in indigenous populations in poorer countries. And so what I found working in Rwanda wasn't that I was bringing arts and health to Rwanda. It was already here. And it helped inspire me to start the program in WHO. And what I learned in Rwanda has formed the foundation of our global program. So I've come to Rwanda, as I did in that first Hamwe Festival, as a learner, not a teacher. Um, in that session, I did give a master class on arts and health. I did give a performance, but it was more as a fellow participant, not as an expert. And the real value for me personally was being an audience, being a member of that community, and taking the love and creativity and science back home with me. And, and it's that richness, that sharing, that taking different points of view and different experiences and harmonizing together as part of the ensemble that was the beauty of that festival. And the fact that it's now, because of the pandemic, become an internet phenomenon and truly global is taking a misfortune like the pandemic and turning it into something quite wonderful. And that, in and of itself, is the power of art. Finding a meaning in chaos, in misfortune. Because at the end of the day, in the most hopeless circumstances, hope is a creative act. And that's part of the connection between art and health, is finding that magic what if, building the future together.
Uh, yes, we're back on. I recall even on the first edition of Hamwe Festival, I had the honor to sit down with you and also speak on how art helps, contributes into the health sector, and it was really amazing. But we're definitely going to come back to that. Dr. Sheila,
went in Berlin, and Berlin was so impressed with what they do that their museum want to partner with us. And you know, Honorable Minister, that we have a partnership with the Museum of Rwanda to
Amazing.
promote heart, One Health, and health as a whole.
Amazing.
So that's part of the question.
That's amazing. That's amazing. You've actually mentioned that Rwanda, we started it in Rwanda, and now it's going globally. This is amazing news. It shows not only that we can create and inspire other people, we can create and inspire ourselves, but we can create and inspire the whole world. Amazing. This is really amazing. Now, to just go back a bit to Dr. Sheila, what role the arts has a partner can play in advancing health equity? Let's just start with you.
Could we have the sound direct to Sheila?
Yes, we can. Right. I think we've seen a lot in movies where kids who have cancers, they like to bring them clown, they like to bring them entertainment, to make them remind them, basically remind them that there's so much more to smile for. I believe that definitely art is definitely, we need to include it in health as much as we can. Now, coming back to you, Dr. Agnes, we've seen the pandemic. We saw the pandemic. We saw how it affected us. Pandemic in late 2019. Could you tell us a bit about that and why the arts are so important in these times? important in these times?
So
Important in
this
these
is an
times.
important question.
Important in
This
these
is an
times.
important question
Important
because
in
this
these
is an
times.
important question
Important
and
in
this
these
is an
times.
important question. There is a great echo the lockdown, the people that were isolated, has deteriorated. Already we know that mental health is a problem. The world has seen a regression in economy. This time, the African continent is rolling back in. Health system has been disturbed. Many people in Rwanda, it's okay. It was well managed. In some countries, it's okay. But in some countries, other countries, it was not the case. People had faced COVID, but has faced also the fact that COVID has halted the delivery of health. Not in our country, but elsewhere. And also now, imagine, every time you read the paper, every time you open the radio, the television, what do you hear? 4 million deaths, we reach 5 million deaths, etc. And also, the injustice in the response of COVID globally. So the news are not good. And you are alone, and we have less interconnection with human. And we are human beings, meaning in our definition, we are living in collectivity, in communities. We miss that. Because when we are sad, what are we doing? We seek support to the loved ones. We seek support, or we just talk to the people we know. And being alone has really bring problems to people. Not also that people who had already mental health problems, without being able to have the follow-up and the support they usually have, were very bad because it was a moment they needed very much and they didn't get it. But now, in some country, pregnant women again deliver at home with all the risk, etc. So the regression of the progress in health, in economy, has really stressed people. And that's where heart can come, because studies have shown that in a community that promotes heart openly, the cohesion is higher, the social capital is higher, students perform better at school, there is less violence, 18% reduction in major crimes, 18% increase in children success in math and English. So I take math and English to show that in science and in liberal art, we see the difference. So it's like art is make us more intelligent. It's making the society more cohesive. It helps people and communities to pass through stress time, challenging time. So that's my answer. Heart is really needed, especially in period like COVID. Thank you.
Right, because most in the period of COVID, of course, we've seen a lot of people who got scared, like you mentioned, were really scared about the numbers of mortality that were there. But when you bring in art, it puts a light into someone's life. It reminds them as to why they need to put a smile on their face and why they need to work towards what they need to work toward to. Now, going to Chris, a momentum in the field of art in health has happened with the creation of WHO collaborating centers, work being to create a global research agenda, healing arts, events in different cities. Could you talk to us about this?
Sure. Can you hear me all right?
Yes, we can.
Okay, fantastic. Just checking because the sound has been going out.
Yes.
At the moment, I'm in New York, and this Sunday we have one of our healing arts activations here in New York at the Metropolitan Museum, where we're bringing together policymakers, researchers, artists, practitioners to talk about the connection between not just effective practice, but how to measure it, how to turn it into policy, how to turn it into a national investment. And we're working with, and we're working with, and we're working with, and we're working with, and we're working.
I'm a researcher, and for all those reasons, I really hope that because research have proven the impact of heart in the health and wellness of populations, we should really see how we can do more. And of course, it's not new. I want to recall that our ancestral practice of healing were always accompanied with drum and song, etc. We need to reconnect with that. And we need to do more research to see how we can help specific needs and specific needs of some populations. But the most important also, we need to give evidence so that policymakers like Honorable Minister can integrate that in law, in policy, in practice, in protocols. Because you know that bringing hearts in a health facilities, decrease the time of hospitalization, decrease the need of painkiller, decrease the need of medicine for stress, decrease the need of medicine for elderly, increase the satisfaction of the service. And in a population, in a community, it increases the participation and the desire to be together, to do something together, to achieve something together. So, if we can have more research to give more evidence to policymakers, to include that in law, regulation, and protocols and strategies, when I told you that 18% more achievement in math and English, We should have that in all schools. Starting the day the child take a first pen to draw something. So, yes, this is what I want. More research for more category of people, age, gender, across the world, more evidence to be shared, and more inclusion in policies.
Now, just to come back to you, Dr. Agnes, you're talking about you're emphasizing on research. Should we start now? Is the research already being done? Or should we start now? Because we can't say we need to do more research. Time is already taking place.
Oh.
But we need to know, is it now?
No, we have already many research that we
Right.
can use. The numbers I'm giving to you are research done across the world.
Right.
Across the world. So we have data. What I say, I need more research. For example, what type of art will help people like me in Kichukiro, in the north, in the south? That means it's this type of implementation research. Don't bring things that will swallow your time and give results you'll put in a cupboard. No, implementation science, what can be used today to improve the life of X, Y, Z tomorrow, if not today night.
Perfect. Dr. Davis, what are your thoughts?
I wholeheartedly agree with what Prof. Agnes just said, and definitely hope that we see that arts and health are an integral part of our educational system, like a place like the University of Global Health Academy, where this is a program that has been launched and prioritized. You know, it's just valuable that we produce empathetic doctors and nurses and global health leaders who are able to listen and be able to be in touch with their heart as well as the art part of themselves, as it is that they're experts in chemistry and anatomy. I think that are really valuing that people fully form as human beings, as empathetic human beings who are our global health clinicians. It's critical for us to achieve the ability to provide global health equity. There's, can't be a nice add-on that has to be integrated as part of core programming, and that's why I'm so glad that UGHE is doing that as a core program. There's a physician poet, Rafael Campo, who says, when pain takes our breath away, how much we resuscitate that. And I think as we look at caring for ourselves as providers and clinicians and all of those towards global health equity, it's important that we also are caring for that part of ourselves and art and thank you.
Chris?
So, we've talked a little bit about physical health, mental health, and social health, and it's easy to talk about these areas in silos, but I think what's interesting, particularly in an arts context, is the interrelationship between the two. If I'm depressed, my physical health will fail. If I have a illness, I'm more likely to become depressed. If I live in a society that is inherently unequal, where I do not have access to health care, that will affect my mental and physical health. And that's a societal issue. And so the negative sides are all interrelated, but so too are the positive sides. If we can start thinking about mental, physical, and social health in an integrated way, as Sheila described, then we can turn it around into a positive side. And the beauty of the arts is that they are combining anyway, that in that moment of shared attention, looking at the performance, it is not just a personal interaction, but a shared interaction. It creates comfort. It creates a context where you can put yourself into someone else's shoes and begin to look at a problem in a new way. It creates community. But most importantly, in the face of difficult circumstances, you can start to imagine a way forward. And people say, well, what do you mean by using our hearts? Is it collaboration. I say, well,
look forward to what's next. We also look at the different research on how to use art in health. Not only talking about entertainment or anything, but how to use it from one person to another according to the age gaps and society and everything. Dr. Agnes, you look like you have something else to add.
Oh, no, no, I'm smiling because I'm happy.
We're definitely happy. We're definitely happy. Well, thank you very much, Dr. Sheila Davis. Just to also give you a small background again, she's the CEO of Partners in Health, and we also had Christopher Bailey, who is also an arts and health lead at the World Health Organization based in Geneva, Switzerland. Thank you very much for honoring us with your time, wherever you are. I hope you're having a nice evening or a nice day.
So I thank you to Sheila and Chris from Boston. Sheila is in Boston.
Oh.
Chris is I don't know if you are in New York now or in Geneva.
New
in
York.
New York. And you can see that we are dialoguing about those so important subjects all over the world. Thank you for being with us and sharing your thoughts.
Thank you very much. Now, moving on, Dr. Agnes, I would like you to do this next introduction. You'll have to give us the honor of introducing the minister.
So,
allow me to give you space.
you give me space. I have all the space.
You're going to be our MC.
I'm going to give you this. So now it's an important moment where Honorable Minister Edouard is going to give us his view and share his view on And also, before giving you the floor, Honorable Minister, I just want to say that as the first one was Insight in Kigali. We were in Camp Kigali. We were so many there. It was great. The second one, because of COVID, we did it virtually, interacting with all the world. And this time, the team at UGHE has produced Heart Piece, a film to show the fight, the use of heart in the fight against COVID for wellness and good health. And we hope that those films, Honorable Minister, you will see them and help us to circulate them. It is free. It's just to really promote the integration of heart in the life of the people. And as when I told you that 18% more success, if I knew I will give so much heart to my kids when they were at school. But we can do so much. So now, everybody, those who are following on video and those who are here in the room, it's my great honor to call on the stage Honorable Minister Edouard to share with us his view. And as I told you, Minister is an artist.
Thank you very much. So you want me to sit or to stand? Sit. Both. Thank you. Tonight I'm not performing. I'm going to give a speech. Dr. Professor dear Agnes Binagwaho, my friend, Vice Chancellor of University of Global Health Unit Equity, dear Dr. Sheila, is she following? The CEO and Board Chair of Partners in Health, dear Christophe, World Health Organization, all protocol observed. It is with great pleasure to have been invited to this great festival, unique and very extraordinary combination of health and creativity. The Ministry of Youth and Culture congratulates the University of Global Health to have established Hamwe Festival. Now it's the third edition. We thank you. Since the World Health Organization declared COVID-19 a global pandemic on March 11, 2020, the novel coronavirus has had an enormous effect globally and in all sectors. The culture and creativity industry have been among the first sector to shut their door in response to the COVID pandemic and one of the most affected sectors. It is very important that the University of Global Health Equity took the lead by establishing such a festival, which support the culture and the creative industry. We thank you very much for the initiative. In Rwanda, the culture and creative industry, composed by plastic art, dance and music, fashion, modeling, beauty, acting and drama, as well as cinematography and photography. The Ministry of Youth and Culture is very happy and aware that you consider all of them in this important festival. I'm saying this because for the next 4 days, music, musicians, writers, filmmakers, dancers, and the other arts will share their experience, creativity, production, as well as collaborate with professionals from the health sector in order to heal our world using creativity. Thanks to the University of Global Health Equity and its partners like Partners in Health, World Health Organization, among others. Through Hamwe Festival, a strong teamwork in the health sector and in the culture sector has proven that we can work together as partners in many ways to improve the life and the well-being of people we serve. Dance and music has been used in generate mental health outcome and having art practice improve learning and generally well-being. There are so many examples where art has been shown to improve physically and mentally health, but beyond that, have a positive impact in social cohesion. In the case of Rwanda, during the COVID-19, art has been participating in response by conveying their prevention message and providing comfort to our people using their talent. Everyone can imagine if we went into this into this lockdown with no music, with no poem, with no movie, you can imagine that the life could not be easy. If I take you back to the life a little bit after genocide, Rwandans, they were supposed to be united. That was the key political agenda of RPF, this ruling party that liberated the country. But I can tell you that the art has played a big role to bring this unity and reconciliation. You can imagine if you have your families who are perpetrators of this genocide. Genocide took place when you were young, and you want to face your parents, telling them to ask for forgiveness, telling them to apologize, telling them to accept their responsibility. It was not easy. But using poems, using a movie, using articles, using books, we are able to tell our parents that they have to apologize, to accept what they did. It was easy or a shortcut to give a message to the victim of genocide, those who survived the genocide, to tell them using art that they can forgive. They can stay together with their perpetrators. It was not easy, but everyone can testify in Rwanda, art has played a role for this post-genocide life. And even when we are remembering, in these 100 days of commemoration, it is not easy. But because of art, we can give a message, we can send a message to the families using this way of art. So I will call everyone to respect art, and I will add that art moves heart. If you want to move someone's heart, make sure you are using art. If you are a man dating and the lady is not responding, make sure you use art. You write a poem, you write a song, or you do any piece of art, then the response will be yes. I thank you for this time, and we are very open. We are talking to universities in Rwanda, different universities. We are going in primary and secondary school to tell them that if we use art, our education will go smoothly. And I really hope you started, and from you we can learn more. Let me just say I'm very happy to announce that this festival is officially open. I deserve something. Thank you.